heard that story that Jojo Kobna did from Pandai about maternal mortality, about all the factors that come together to contribute to maternal mortality. We'll bring you that story as we look at what mothers go through or women who are making strides for survival.
Using the Salaga to Pandai District Road in the northern region of Ghana is a nightmare. Even with a good vehicle, navigating Pandai is very difficult. And as the dust settles, we are greeted with this. Idonker is in pain. She can hardly balance on the motorbike. We learned despite her laboring throughout the night, the baby would just not come out. She had just started bleeding, so her husband and sister carried her on the motorbike to the hospital. At a point, we couldn't bear simply filming a woman in labor groaning on the motorbike.
Let's go.
It takes more than 1 hour on the motorbike to the Pandai Polyclinic, the nearest health facility. But with our four-wheel vehicle, we could make it there in 45 minutes. Even in the relative comfort of our vehicle, Idonker still winces in pain as we move on the road riddled with potholes. Her sister clutched her family to give her support, but the labor pains were excruciating.
The hospital left or right? Okay.
Eventually we got to the hospital, but we could not use the main entrance because of construction works there.
Chief, sit down. You sit down.
You relax, so that we can get a wheelchair quickly get there. So we're just waiting for a wheelchair to carry Idonker into the hospital. We couldn't get access to the main entrance because motorbikes had blocked the place and there was no access. And so currently we are waiting for a wheelchair so we can carry her through to the hospital so that she can safely deliver.
Let her come down small. If not, she's heavy. You can't lift her. Hold on. Sit down. Can I sit?
Interestingly, we were about the first vehicle in a long while to bringing a patient, as most of them arrived there on motorbikes, the most common means of transportation. We finally make it to the delivery ward and the medical team takes over.
The baby is coming.
It has been 30 minutes already and Idonker's baby is still yet to come out. Her situation begins to deteriorate. The only obstetrician there is away for medical training in the regional capital, Tamale. According to the Ghana Health Service protocol for fetal distress, as is happening in Indonkur's case, the nurses are supposed to call for help, arrange for an ambulance, and refer her to a better equipped facility.
The baby is alive, but because of the way she wasn't cooperating in the position of the baby that I wasn't getting, but when they did the scan, it's still alive.
But vehicles are rare here, and ambulances are actually a lot harder to come by. So once again, our vehicle comes to the rescue. At the Evangelical Church of Ghana Hospital, the only doctor available had just started an emergency cesarean section, so Idonkur had to wait her turn.
Madam, it's just the tomato here.
The local simple.
After observation, the midwife realized that she's too fatigued to push, so it is scheduled an emergency cesarean section. Unfortunately, the hospital does not have drugs for the emergency surgery. What time do you think this one will start?
It depends on the time that
the doctor will finish.
No, they will bring the drugs from town.
You don't have drugs? What kind of drugs?
The
infusions like Rangers, normal saline, and then
You don't have
the D5.
Yes.
How? What happened?
The insurance is owing us and they are not paying us. For the past 18 or 16 months, the insurance is not paying us. So we are doing our own papa to run the place.
So Idonkur's husband, Jagri, is asked to get the essential medication for surgery, also some 5 minutes drive away. The obstetrician cannot hear any fetal heartbeats. He's scared the baby may be doing badly and decides to concentrate on saving the mother.
That's great. Father, we thank you once again. We commit this case into your hand and take control. Okay, good. So, now go. You need to take a brush.
It's a boy, and everyone is excited. Idonkur, fortunately, does not end up as one of Ghana's grim maternal mortality statistics. In 2016, out of every 1,000 live births, 378 women died. This figure could be equated to 42 9-seater trotro urban buses crashing and killing all passengers. In northern region alone, 136 maternal deaths were recorded in 2016. Jagri was excited. He named the boy right away.
Joy.
Idonkur is also doing well.
That is not better. It's not like yesterday.
Yesterday, how was she feeling?
Yesterday she was in danger. She was in God bless you. You keep it up.
Dr. Sonla Joseph is glad the surgery was successful, but he's not entirely happy because of the way patients such as Idonkur are made to purchase their own medication, including those covered by the National Health Insurance.
Since July 2016 up to today, In fact, the last submission we made was September. September submissions was made 8th of November 2017. And we submitted July 2016, 20th of September 2016 last year. And up to now, no payments have been made from this. And so National Health Insurance owed this small facility over 700,000 Ghana cedis. We rely heavily on what insurance pay us to manage the running of the hospital. That is where we buy medicines from, that is where we buy consumables, and that is how we run the administration. Just imagine that for over 15, 16 months, we have not been reimbursed from the National Health Insurance Authority. What are we going to use to buy drugs, to buy consumables? One thing that we don't have is an anesthetic machine. We don't have an anesthetic machine. And if you realize yesterday, the anesthetist yesterday, when he was trying to give the spinal anesthesia, he struggled. He struggled because he had a difficult spinal anesthesia yesterday. And so it could have happened that he would have failed in getting through the spinal anesthesia. If it doesn't work, then you need to put the patient on general anesthesia. So the patient goes sleep fully, and then you have time to work on the patient. Things are going on well. Nobody is talking. But I tell you, when you rush the emergency in, if we were not able to intervene and save this woman, I am sure that the people who are not listening to us will turn their eyes towards Evangelical Church of Ghana Hospital and say that no, maternal mortality has occurred. Let's go and find out what is happening there. But we struggle with the limited equipment and effort to save the lives of people. So because of that, people have forgotten that things are not well. I am appealing to you, to anybody who listens to this story and is touched, to come to our aid. A certain machine, averagely, if you have about 50,000, 50 to 60,000 for our level, is to be able to get us an anesthetic machine. At least this is to serve as a guarantee for quality care of our pregnant women who cannot deliver and have to go to theater.
From the public health perspective, one of the causes of maternal mortality in Ghana is delay in accessing health care. He makes reference to dangerous practice of sending patients to hospitals on motorbikes due to lack of vehicles.
It can be an obstructed labor like what you brought yesterday, that the baby cannot come out, but the labor, the contractions are going on. And so the uterus can rupture and this woman will be bleeding inside. But for them, that is the only means of transportation. Now when the bleeding is so severe, the woman can get into shock. And when you get into shock, it means that your blood levels have dropped. And so blood supply to the brain is reduced. And so if it's not rectified immediately, you can die. Yeah, but they'll carry them. And the ideal thing is that if your blood levels are dropping and you are in shock, you should be in a lying position, at least for a small quantity of blood that is left to supply the brain until when you are resuscitated and the blood volumes come back to normal. The attention cannot be concentrated on some areas, leaving especially the rural areas. When even the health professionals are not willing to go there, then the few that go there, they have difficulty in getting the right equipment to save the people that we all say that we want to save. Because we are capable of rendering the services, but we are incapacitated by lack of basic things.
The district chief executive of Pandai, Kofi Takablata, says the entire district now has one functional ambulance that is stationed far away from the district capital, Pandai.
we have a lot of challenges. But the nature of our role center is very difficult when they are transferring a patient from a chief compound to a clinic or the hospital center. You need to carry the fellow on the motorbike to the hospital. And sometimes it's very difficult, somebody who cannot sit on the motorbike. It's very difficult.
Idonkril's story definitely brings closer home how development infrastructure, such as good roads and hospitals, can make a difference in the lives of citizens, and the implications of government's failure to reimburse hospitals for the cost of care given patients on the National Health Insurance Scheme so they could restock basic supplies. It also brings to the fore the need for governments to invest in emergency care, such as provision of ambulances. Because who knows how it would have turned out in Idonkril's case if she had to be hopping from one hospital to another on the back of a motorbike, had the news crew not showed up when it did. Jojo Kobna, Joy News.
Jojo Kobna filed that reports that has to do with the sort of pains of motherhood, what some mothers are going through. Well, we're still focusing on empowering women and girls, even though we're looking at autism, we're looking at women in general. So, having spoken about what women go through, here is another story about a woman going the extra mile to save other children. She's a doctor, but she doesn't just stay in the hospital and watch children die. Once some children have died on her hands, she decided to step out and start asking for support to support children living with cancer. Are dealt with here at the Holy Family Hospital in Techiman. The hospital finds itself at the crossroads on a daily basis, serving Ashanti, Northern and the Bunahafo regions. Dr. Jacqueline Ezibe has just finished administering a monthly unusual dose to a university student with cerebral palsy. She has been taking care of the 21-year-old since he was only a baby. That is what she does. The only pediatrician at Techiman's major hospital would have attended to about 100 outpatients and 15 inpatients by close of day today.
One of the major problems for me as a pediatrician working in the district hospital is financial constraints on the part of the parents.
Illiteracy and poverty breed a cycle of malnutrition and teenage pregnancy here in Techiman. So has it increased prevalence of children living with cancer. Dr. Esibe and her team stand for two causes: keeping cancerous children of poor parents alive and campaigning to reduce teenage pregnancies.
Most children would come, the parents are not there, the mothers cannot afford, so these children are sick and need to be seen. We have boxes that we put at the filling station, the shops, the hotels, the people, and then we have pictures of patients that we've treated so that people look at it and then they donate into the boxes. We go and get them. And then during the year we have a lot of programs where we send letters of sponsorship.
Without this intervention, about 30 children could have either died or continued living with cancer. Here are living examples. Dr. Sibe has come for a daily review here at the neonatal intensive care unit of the Holy Family Hospital. Like many hospitals, incubators here are shared. 6 out of these 8 incubators were donated, and only 1 manual ventilator is available.
So then we have to go on manual, and 1 person cannot be here. The best you can be is 30 minutes. Okay. Then you have to change over. But you don't have enough staff to be changing every 30 minutes. For how many hours? And the more you ventilate and the more the baby is not responding, what is happening is that not much oxygen is going to the brain. Okay. So the brain is being damaged. Hypoxia, the brain is being damaged. And if even the baby makes it, you have long-term problems like cerebral palsy that we see.
Mothers sit by shared incubators, clinging on to faith that their babies survive and without infections from the other babies. One of the hopeful mothers here, her 6-month-old baby, delivered through a cesarean section, has survived 3 weeks outside the womb so far. Unlike Ajwa Comfort's baby, this set of twins are a few weeks old. But Dr. Esibe is optimistic of their survival. She says they have seen worse. Worldwide, about 15 million children are born premature yearly. But here in Techiman, Dr. Esibe believes teenage pregnancy is the major cause of such preterm babies. With limited incubators, they have introduced a relatively new intervention, the kangaroo mother care.
It keeps the babies warm, the mother's heat is transferred to the baby, and this one is inexpensive. You don't need anything. You just need a willing mother and clothing to tie. So it's as compared to incubator, it consumes lots of electricity. But this one is inexpensive. It's shown through research to prevent infection. While the baby born to the mother, he picks some bacteria from the mother's body that protects the baby. The baby is there. The mother's chest is breathing and touching the baby, stimulates the baby to breathe all the time.
The kangaroo mother care works similarly to incubators, but cannot completely replace the baby life-preserving machines. As of 2013, 105,000 people lived in Techiman. The figure must have doubled. They all depend on this hospital. The pressure on health officials and facilities here is imaginable. It's worse in the absence of an effective health insurance system.
The beginning of health insurance was so amazing. We discharge a patient, he takes his bag, he goes. It was
such a relief.
I mean,
that for you as a doctor, it even helps you to feel better.
It was so easy. We discharge you, we do the paperwork. In a few minutes, they are going home happy. I was part of it. I felt that excitement as compared to now. That the system is really slow.
These healthcare issues have already been addressed by government, except it is only on paper. The NPP's manifesto pays critical attention to the NHIS with a promise to, quote, revive and to finance health services on a timely basis. Again, the governing party promises to, quote, establish centers at all levels for early detection and prevention of cancers, key among which childhood cancers. All of these are to be, quote, paid for under the restructured and revitalized NHIS. The reality, however, is the NHIS is still saddled with debt. The cancer detection centers have not yet been established. Dr. Esibe retires from work daily with satisfaction knowing cancerous children of poor parents are alive because she is raising funds for treatment and that her campaign of reducing, if not eliminating, the mounting trend of teenage pregnancy in Techiman is working.
If we get more funding, we'll be able to support more children. I'm very happy because we put a lot of smile on lots of families. They are very happy with the support. The cancer patients we've treated, between 20 to 30 people have benefited. The malnutrition is a lot.
But some avoidable deaths do occur. That takes an emotional toll on her.
On a daily basis, this one is dying, but there's also another emergency you have to take care of. So it helps you to forget. There are some losses. It takes a while for you to forget about it. It really gets down to you that this patient or this child could have been helped, but because of some logistics or equipment problems, it could not be helped. It really takes quite some time to forget.
On a cursory look, this hospital is close to perfection. But beneath the appearance of perfection lies the similar problems that are faced by many hospitals in this country. One of the differences being made here, though, is that a female doctor is raising funds to support children, especially those with cancer. Gifty Andopia, JoyNews, Techiman, Punahafu region. So you know the problem, you know that somebody is making a difference, so can you. As we celebrate women and as we celebrate women and girls with autism, let's come together to support our own and, you know, at the end of the day, hope for better lives for everyone. Away from women and all the issues that come with women, Chief Fishermen and